Hi everyone, my name is Charles Burchfield. I go by Buck, and I'm sure that I have had a number of you in other classes as I wind down this BSN program. I still have a few classes left, but by and large, it's been a long time, and I'm looking forward to get it behind me. I particularly like this class because the research and evidence-based nursing. I work at UAMS. I am the assistant director of nursing. So I work day shift. I go in 6:30 in the morning. I start looking at morning operational reports, uh, what went on after we left the day before, and the events of the night. So it's a busy place. But we are absolutely into research and evidence-based practices. So I have got a large amount of experience with scientific research. I have been involved in a number of committees that were involved in scientific research. We pride ourselves on being the standard leader, and we have developed a lot, like the Hester Fall Assessment, neurology. We have really produced a lot of good stuff for nursing out there. Our cancer research and the nursing involvement has been huge. So I have a lot of pride in the work that our hospital puts out for nursing. I've been at UAMS for 12 years. Before then, I worked as a director for the DBHS for the Act 911s. And the facility I came from did not use evidence-based practices. It did not use any qualitative or quantitative measures. It was a 350-bed nursing home that housed mentally ill patients. And everything from pharmacy to nursing policies and procedures were all antiquated. And that while I was there working in a managerial role, I wasn't in a director's role. They almost shut us down. So I went through 2 years of terminations, the higher ups bringing in new people who showed us some different practices, but none of them were evidence-based practices. And to my knowledge, they still don't use evidence-based practices. They go by guidelines set up by long-term care that maybe some other people have some input, but certainly this facility doesn't spend time, effort, money, or whatever, because they don't have the resources really. But I want to look. I've also spent 20-something years. I've been a nurse for 27 years. And a lot of those years, all those years have been in management. But for the most part, 20 years, I have been working, moonlighting in psychology. I've also done some staff ed. And but in management and in psychology, I have witnessed compassion fatigue, burnout. And I think that might cause some violence in the workplace. Certainly it's a dissatisfier for the nursing profession, which bleeds over into unsatisfactory scores on the patient side for the nursing care. So I like to look at employees when they're starting to brown a little, before they burn out. I call it brownout. But I would like to do some research and study on on creating a culture where violence is less likely to occur, because I believe that violence occurs mainly in the workplace due to employees just not being happy through burnout. And I'm going to target population, of course, will be nurses. I want to compare work hours, patient to nurse ratios, acuity levels, environmental factors. There's so many different things I believe that we can go into to look at creating a culture or maybe a paradigm shift into satisfying the compassion fatigue that will eliminate, for the most part, severe burnout where it actually affects patient care. And because that's why we're nurses, to take care of our patients. Anyway, I look forward to seeing your videos. Feel free to critique and tell me anything. I'm married. I have 8 children and 2 grandkids. So I have a busy life. Anyway, thank you for watching my video. Take care. God bless.